Hello and good afternoon. This is Kuldeep Chaudhary from Health in India. I'm at Sethi Hospital in Gurgaon, and we've been joined by the promoter of the hospital, one of the most renowned orthopedic and joint replacement surgeons, Dr. Sethi. Dr. Sethi, who started his practice almost 3 decades back and built the Sethi Hospital about 15 years back, has a very big reputation in the city of Gurgaon when it comes to orthopedics in the field of accidental trauma, patients who suffer multiple fractures and road traffic accidents, and patients who require joint replacements. Let us begin by asking Dr. Sethi, what exactly is the trauma management program? Good afternoon, sir.
Good afternoon.
I've seen Sethi Hospital has a fairly big reputation when it comes to the management of seriously injured patients. So what is your approach in such patients who have suffered multiple trauma, have fractures and even head injuries, all those sorts of injuries?
We have a group of doctors who are ready to treat any trauma, anytime, round the clock in our hospital. And I'm in Gurgaon running this hospital right from 79, it's almost 32 years now. And we have done all the major surgeries, which includes major traumas, replacement surgeries, knee replacements, etc. And whenever the patient comes, we get a call and the whole team is ready, including the anesthetist, registration members of the team. They rush up to the casualty, patient is shifted to the OT, and the first thing is to resuscitate the patient for any major eventuality, and we do the surgery in the same day as far as the trauma is concerned. And for replacements, we organize everything according to the need of the patient and time, and after investigation, when patient is fit, patient undergoes the surgery whenever the requirement is there.
So Dr. Sethi, you have a full-fledged team which includes general surgeons, neurosurgeons, yes. But I believe the role of an orthopedic surgeon is the most important in multi-trauma patients.
Yes, because I am running this hospital and most of the time I am present in the hospital. So it's my responsibility to take care of the patient initially, and after assessment, the whole team is, whenever it is required, they rush up for my help.
So Dr. Sethi, you've been doing joint replacements for a very long time now, and you've been very successful. The patients are pretty happy about the surgical results. So for the benefit of our viewers, just let us know from your experience, what are the typical causes for the patients who require joint replacements, whether it's hip or knee?
See, the most common of joint replacement is advancing age. Because of osteoarthritis and osteoporosis, they have a lot of problem, especially the pain. It is the osteoarthritis, osteoporosis, the vascular necrosis, and of course the trauma also, the major indication of joint replacements.
So Dr. Sethi, how is the diagnosis made? You said osteoarthritis, that is probably tested by some blood tests and all. But once you take a decision for joint replacement, do you require the patient to get an MRI done?
Yes, a patient undergoes BMD test, MRI test. These are the basic two tests which gives the whole information regarding the condition of the joints. And if necessary, we go further testing also, which help us to diagnose the condition of the joints, and ultimately then we decide, after having battery of tests, whether patient requires a joint replacement or not. And basically the investigations are MRI and BMD.
Okay. So when a patient undergoes a joint replacement surgery, these days we have very good quality implants.
Yeah.
How many years do these artificial implants last in a patient?
In my experience, it's approximately 15 to 20 years. That is the life of an implant for any old man, and they work well. Usually we are using Stryker, Johnson & Johnson and implants which are better life.
Okay, Dr. Sethi, so these patients who require joint replacement, let's say a hip replacement, do they require for both the hips or just one hip?
Depending on the condition of the hip. Sometimes it is only one, but if both are both the hip needs replacement, we do simultaneously both the hips.
And what is roughly the cost of this surgery?
Approximately 1.5 lakhs. That is approximately for for one hip.
For one hip it is 1.5 lakhs, which means
depending on the implant we use and what patient prefers.
So basically the international patients can get it done for somewhere around $3,000 for one hip
approximately,
and $6,000 for both the hips.
Approximately.
Which is almost 1/10 of what they pay in say United States of America.
Probably.
Okay, thank you Dr. Sethi. Thanks for joining us and enlightening our patients about the work being done at Sethi Hospital and the joint replacement program that you run at the hospital.
Thank you very much. Thank you.